Bismillahirrahmanirrahim. Assalamu alaikum. My name is Amanurose and my roll number is BP 1450008 and I'm the student of 5th professional morning. Okay, so the topic that was assigned to me for my presentation is the drug named as Nalidixic acid. So let's first talk about the main indication of this drug, means in which condition this drug is prescribed. This drug is prescribed mainly to treat UTIs, means the urinary tract infection, and especially those UTIs which are caused by some gram-negative microorganisms or gram-negative bacteria, including E. coli, Enterobacter species, Klebsiella species, Proteus species, and etc. This drug may also be given in some cases of diarrhea, but mainly this drug is meant for UTIs. Major side effects. As we all know that each and every drug that we use do have some of the side effects. So in the case of Nalidixic acid, first side effect or the major side effects that are its major ones include or are related to the central nervous system, means our CNS. So the effects that this drug cause on CNS, means our central nervous system, include drowsiness, weakness, headaches, dizziness, vertigo. Vertigo means chakkarana. Okay, the next side effect category is related to those which are on the GI tract, that is the gastrointestinal tract. These side effects of nalidixic acid on GI tract include abdominal pain, loss of appetite, nausea, vomiting, and diarrhea. This drug also cause some side effects related to the allergies, means some allergic effects or allergic reactions also caused by nalidixic acid, which include rashes, pruritus, urticaria, angioedema, eosinophilia, arthralgia, joint stiffness and swelling, and etc. And some of the syndromes like erythema multiforme and Stevens-Johnson syndrome. Okay, let's talk about the drug interactions. Nalidixic acid, when is prescribed and when it is used by a patient, so it is also important to check what other medications or drugs are used by that patient, because there may be an interaction of nalidixic acid with some other drugs, and they both may interfere in the efficacy of each other. So the first drug interaction includes the interaction of nalidixic acid with anticoagulants, means the drugs which are used for the anticoagulant purpose. Okay, so in this case, nalidixic acid may worsen or it may enhance the effect of warfarin or its variants. Warfarin is an oral anticoagulant here. So in this case, prothrombin time or another relevant coagulation test must be regularly watched when these products are given together. So in order to check whether these both drugs are interacting. Or if not, then it would be fine. But these tests must be done in order to check whether these two drugs are interacting or not. Okay. Next drug interaction is related to probenecid interaction. Means probenecid reduces the nalidixic acid tubular secretion, lowering its efficacy in the treatment of urinary tract infection while increasing the risk of systemic side effects. It means that when probenecid and nalidixic acid are given together to a patient, so this drug probenecid may reduce the efficacy of nalidixic acid in the treatment of UTI. Means there would be lesser chances that this nalidixic acid is going to treat the UTI properly. So these both drugs should not be given together. There may be a drug interaction. Okay, the third interaction is with antimicrobials. Nalidixic acid is itself an antimicrobial drug, so it may also interact with some other antimicrobial drugs given together with the nalidixic acid. So particularly bacteriostatic agents like tetracycline, chloramphenicol, or nitrofurantoin, which are hostile to nalidixic acid in vitro, may inhibit nalidixic acid. Means these drugs which I have mentioned above, these drugs may interact with the nalidixic acid and may inhibit its activity in treating the UTI. So obviously the nalidixic acid would not treat for what it is given for. So these drugs should also not be given together. Okay, now let's talk about anti-cancer drugs, interaction of nalidixic acid with some anti-cancer drugs. Concomitant usage of nalidixic acid has been linked to serious GI damage if we use anti-cancer drugs along with the nalidixic acid. So it may cause some serious GI disturbances. Now, interaction with antacids. Antacids containing magnesium, aluminium, or calcium, sucralfate or divalent or trivalent cations such as iron, multivitamins containing zinc, or chewable or buffer tablets or the pediatric powder for oral solutions may significantly interfere with quinolones, means our nalidixic acid, quinolone absorption, resulting in systemic levels that are significantly lower than desired. Means that if any of these drugs mentioned earlier, these are given with nalidixic acid, they are going to reduce the activity of nalidixic acid, by reducing the systemic levels, means that the drug, the quantity of the drug that reaches to the systemic circulation, it would be reduced, and it would not be enough, or which is significant or important for producing its effect. So its lower systemic levels would obviously will fail to treat the UTI infection for which the nalidixic acid was given to the patient. So these two drugs should also not be given exactly together, but these medications can be given after few hours of the nalidixic acid. These medications should not be taken within 2 hours of nalidixic acid administration. Otherwise, after few hours, they can be given. Okay, drug irrational use and toxicity. Irrational use of drug, it means that the improper use of the drug means if someone used the drug, any drug, in a way that it was not meant for. It is called as an irrational use. It may be related to the dose, means if let's suppose if a drug is given to a patient by a physician or a pharmacist, which is more than the required dose or the normal usual dose, this would also come in irrational use of that drug. And if the patient is prescribed a drug, let's suppose an antimicrobial drug, and the patient was not having the any microbial infection, but still he was prescribed an antimicrobial drug, it means it is going to be an irrational use of the antimicrobial drug because it was not needed, because the infection was not due to any microorganism, the disease was not due to any microorganism. Still the patient was prescribed to have antimicrobial. So obviously this would be an irrational use of antimicrobial. So this is a summary regarding the irrational use of drug. So in case of nalidixic acid, uh, obviously if any drug is used improperly, it is going to cause some problem, some toxicity in the patient. So patient who take more than the authorized amount may experience toxic psychosis, convulsions, elevated intracranial pressure, or metabolic acidosis. Overdosage can also cause vomiting, nausea, and tiredness type symptoms. Okay, so let's talk about major alternative choices of our drug, that is nalidixic acid. Means if not available or if not used, then what can be given in place of this drug in order to treat the UTI infections, means our UTIs. So this drug include trimethoprim and sulfamethoxazole. This is basically a combination. These two drugs are given together as a combination in order to treat UTI. More drugs include, means more choices that we have are azithromycin, cephalexin, by the name of Keflex it is, and ceftriaxone, ciprofloxacin, and levofloxacin. All these are the second generation fluoroquinolones, Cipro and Levo, etc. So these drugs can be given in place of nalidixic acid. Why? Major reason for these alternative choices is that these drugs that I have mentioned above do have a broader spectrum than the nalidixic acid. Means nalidixic acid is only going to treat the UTIs that are caused mainly by the gram negative microorganisms, but these drugs have a broader spectrum. They can treat the UTIs which are caused by gram negative as well as some of the gram positive bacteria. So these are the alternative choices in case of nalidixic acid. Okay, alternative brands with prices. So if we talk about our country, Pakistan, most common brand by which in which nalidixic acid is available, the most common brand in Pakistan is Negram, which is manufactured by Serle Pharma, and but we do have some other choices, but this is the main one. So here I have discussed the two major dosage forms of in each brand or in each choice, which is the suspension and the tablet. These are the two major dosage forms. So if we talk about a Negram produced by Serle Pharma, so a pack of 30 tablets, each tablet of 500 mg, its price is around rupees 80 to 81. And if we talk about the suspension, so 60 ml bottle having the nalidixic acid suspension, its price is rupees 88. Other brands include Nexid, which is manufactured by Stanley Pharma. It is same, the nalidixic acid, the major active ingredient or the API here is nalidixic acid. And the same, the pack of 30 tablets, each tablet of 500 mg, its price is rupees 120. And a bottle of 60 ml suspension price is 80 rupees. Then we have Nalid, manufactured by Glitz Pharma. Its 500 mg 30 tablets package price is 148 rupees, while 60 ml suspension bottle price is rupees 40. And then we have Neldox, which is produced by Xenon Pharma, which is, I guess, in Lahore. Yeah, it is in Lahore. So this Neldox, again, 500 mg 30 tablets package price is 110 rupees, rupees 110, and 60 ml suspension bottle is for rupees 40. Okay, available dosage forms of nalidixic acid. Nalidixic acid is available in four major forms or dosage forms, which are tablets, capsules, oral suspensions, and caplets. Caplets is basically the combination of capsules and tablets. It is in the shape of capsule, but it is slightly flatter, sort of elongated flat tablet, like capsule shaped tablet. So this is called as caplets. Okay, so if we talk about tablets and capsules, these both are suitable in youngs or adults who do not face any difficulty in swallowing the tablet or capsule. While oral suspensions and caplets are good to be used in pediatrics and geriatric patients, means the patients of older age, and means geriatric patients means patients of older age, and pediatrics means childs and even childs and infants. Okay. Okay, so now we have a case study related to nalidixic acid. Let's move on the case study. So we have Elizabeth Wilson, a well-appearing 26-year-old woman who visited the clinic with complaints of dysuria, that is increased urinary frequency or urgency, over the past few days. It has been increased up to every 1 to 3 hours during the past 2 days. She also complains about pain in lower abdomen near bladder. Her blood pressure is about 122 by 78 mm of Hg. Heart rate is 72 beats per minute. Respiratory rate is 16 breaths per minute. And her body temperature is 38.5 degrees Celsius. She has gone through a urinary culture recently, and its report indicates the presence of gram-negative rods in her urine sample. She has previously visited a hospital and was prescribed TMP SMX, but experienced severe rash with this medication. She also has type 1 hypersensitivity reaction to penicillin. Explain the case management with best possible treatment. Okay, so let's move towards the SOAP notes of this case study. Subjective. Patient age is 26 years old. Gender is obviously female. Present symptoms are dysuria, urinary urgency. Urinary urgency means there is an unexpected urge of urination. There is an unexpected urge of urination every time, and even it may cause some emergency for the patient. And suprapubic pain. Suprapubic pain is basically the pain which is in the lower abdomen. Lower abdomen means near hips and the bladder and the genitals. This is included in the suprapubic pain. Okay, so these are the present symptoms of the patient. And the medical history includes that she previously visited a hospital and was prescribed TMP SMX combination, which is the one that I have told earlier in my presentation, that it is the combination of two drugs, trimethoprim and sulfamethoxazole. So by taking this drug, the patient experienced rash with this medication. So she also has a type 1 hypersensitivity reaction to penicillins. Okay, so objectives. In objectives, let's talk about the vitals of the patient. Blood pressure is 122 by 78 mm of Hg. Heart rate is 72 beats per minute. Respiratory rate is 16 breaths per minute. Body temperature is 38.5 degrees Celsius. Means vitals shows the condition of the body is normal, means the vitals are normal, in normal range. And laboratory data says that a urine culture was done, and the reports are positive for the presence of gram negative rods, means gram negative bacteria are there in the urine sample of the patient. Okay, so assessment. According to my assessment, Elizabeth Wilson is probably suffering from uncomplicated UTI according to her present signs and symptoms, her complaints, and the laboratory test of the urine culture. Also, her recent history of medical treatment with the TMP SMX combination is indicating that she was also she was also diagnosed as having a UTI earlier. Okay, so plan. Uh, According to this case, or in this case, the therapeutic treatment, uh, the first line of the therapy in the case of uncomplicated UTI includes the combination that I already told in my presentation, that the drug combination of the trimethoprim and sulfamethoxazole. But since this patient is allergic to the first treatment, this first line therapy, other choices include fluoroquinolones such as norfloxacin, ciprofloxacin, levofloxacin. I have also discussed about these drugs, but means these drugs can also be given to the patient as second line therapy, but these drugs are slightly expensive with various side effects. So here nalidixic acid, which is quinolone, can be given to her in the dose of 1 gram orally 4 times a day for 7 to 14 days as initial therapy. So if I consider each and everything like price point and efficacy and everything, so I would suggest I would give nalidixic acid to this patient uh, in the dose of 1 gram orally for 4 times per day for 7 to 14 days as an initial therapy, which would be good enough to treat her symptoms. But for further treatment, or for complete treatment, or for complete eradication of the bacteria from her urinary tract, prolonged therapy may needed. And in the prolonged therapy, the daily dose of the nalidixic acid drug would be reduced from 4 gram to 2 grams. Like we were giving 1 gram 4 times a day in the initial therapy, that was total 4 grams per day. So in the prolonged therapy, prolonged therapy, this dose would be reduced to 2 gram daily, and this prolonged therapy would start just after the initial treatment ended, or the period of initial treatment is ended. So that was all about my presentation, and these are the references of the books and the web links. Thank you.